Hi, everyone, and thank you for joining CIVHC's monthly Change Agent Chat. I'm Kari Degernis. I'm the Director of Healthcare Programs here at CIVHC. Before we get started, just a couple housekeeping items to mention. All the phone lines are muted. We will be using the Q&A feature on the field questions to make comments or suggestions or questions, so feel free to use that throughout the session. The webinar is being recorded, so we will post it onto the CIVHC site so you can access more information later without any additional cost. Today we will be speaking with Tim Gaudette, External Affairs Advisor for the Coalition to Transform Advanced Care, also known as CTAC, and I'll have Tim introduce himself before we get started.
Hey, good afternoon, everyone. My name is Tim Gaudette, and I am the External Affairs Advisor for CTAC, a coalition to transform advanced care. I am a 21-year resident of Colorado. Very, very excited to be helping CTAC get introduced to the state and to the region. The work we are doing is crucial, it's imperative, it's hard to avoid, and we're really excited about the reception we've had in Colorado over the last year or so, and our partnership with CIVHC. Very, very excited, and we're really looking forward to our summit in October and building long-lasting relationships with a state that was selected for this summit, first one ever outside of Washington, D.C., because of the way we lean into healthcare and how we care about the health of our citizens here in the state of Colorado.
Wonderful. Well, I'm sure our listeners are a little interested to hear more about what CTAC does and how it operates to fulfill its mission. Can you share a little bit more?
Yeah, again, the Coalition to Transform Advanced Care brings together groups and individuals from a variety of backgrounds. It's a big tent idea who share the common goal of working toward improving advanced illness care. Our partners include hospices and providers, but we also support faith leaders who have deep roots in the communities, which make them uniquely qualified to reach people with advanced illness and their loved ones. One of the issues that we deal with is how challenging and difficult it is in America to speak about advanced illness and where that may take us, which is sometimes end of life. CTAC, the coalition, is invested in changing the healthcare delivery and payment systems. To this end, CTAC has developed an advanced care model, which is specifically designed to meet the needs of people with advanced illness. This is an advanced alternative payment model which aims to break down silos. We know silos exist in healthcare, right? So break down the silos among professional groups, bringing traditional medical and social services together. And what was really exciting, after a multi-year effort with lots of friends and partners and input from the coalition, CTAC submitted this model to a committee within the U.S. Department of Health and Human Services for review this year, and it has been recommended to the Secretary for testing. So that's really exciting, really something that we look forward to talking about at the summit and talking about possibly some partnership and hopefully some dates and times when this will start, but government may take a while. And some of the significant points we want to make is that the coalition, the leadership, the effort understands that in order to improve advanced care, you need to be able to track progress. So one of the other things that I think CIVHC is very interested in, and many others, is our Advanced Care Transformation Index, which measures 25 measures to determine the quality of advanced care in our country. So that's great, right? That's a macro view. What's exciting is since that came out a little while back, we're also close to finishing a state-level index, which would allow a lot of our partners, a lot of the people attending, perhaps even our newest visitors, to start working with state-level information that will be introduced at the summit in October, 9 through 11, downtown Denver, so I have to say that. And then the other idea that CTAC gets involved in is policy. And we were pleased to see that a bill known as PCHETA, if I said that right, the Palliative Care and Hospice Education and Training Act, was recently passed in the U.S. House. Things actually do happen in D.C., so we're really excited. It was a big priority legislatively for us. And what it does is it improves the training of health professionals in palliative care. It expands the national research in this space and educates families and health professionals about the value of palliative care. It is an area that we think has been underutilized and educated about. So those are just a couple big things that I'd like to highlight.
Wonderful. Definitely very in line with some of the work CIVHC's doing as well, so it's fun to have that partnership there. Well, speaking about the conference, you kind of touched a little bit about what people will kind of walk away with, but are there any particular sessions that you want to share about, or great key points that folks you feel will walk away with if they attend?
Yeah, you're kind of asking like which trial do I like better. We're really excited about all of our presenters and workshops, but the theme of this year's summit is solving the how. I think over the many years that CTAC has been around, and this will be our 5th summit, many people get the what and the why, and we've heard feedback from summit attendees, from coalition members, that they're really interested in the field on how do I do some of this work. I hear about it, it sounds great, but I'd really like to get examples of how. So we're going to have a lot of workshops and presentations during this year's summit that will provide concrete advice and insight for attendees on a number of topics. So payment demonstrations all the way to community engagement. So a wide spectrum of things that people can really grab onto, investigate, and take home. And we think it's also, it's a big trend idea, like I said earlier. So the networking, the connections you can make are going to be great. We're going to bring together stakeholders and thought leaders from across the country. This new geographic location, instead of just being in Washington, we think it's going to bring new faces and new voices and new audiences. So you're going to have providers, you're going to have health systems, you're going to have insurers, you're going to have consumer groups and patient advocates, and that's just a few of the attendees we get. And we'd like to make sure that everybody who attends leaves with a clear sense of what is going on in advanced illness care. So we'll also have policy updates on what's going on in Washington, which I allude to, there has been some progress, and what's going on in other places around the country. And then in terms of the speakers, I'm going to highlight 2 if I can. Shirley Roberson, Shirley is living with cancer. And, we understand that, in advanced illness, that's often one of the things we hear, that you have a pretty tough road to hoe. And Shirley is going to share the story of a visit to her doctor where she just felt he wasn't quite listening to her, in that she basically told the doctor, sit down. I have some things I need to say, and there was a blue chair. So we're going to have, going forward, I think, in the summits going forward, these blue chair conversations about patient and provider engagement, which is often a real stumbling block because all of us, or a lot of us, take our doctor's words so heavily into the heart, and we know that in the healthcare world, time isn't always bountiful, and that to get things clear, you really have to take that moment and have a real conversation. So that's one that we're really excited about. And then the other one that many people have maybe saw or seen last year, we're repeating a great conversation with Tim Bauerschmidt and his wife, Ramey Little. They're the authors of Driving Miss Norma. And Driving Miss Norma was kind of a social media phenomenon in the last many years, where Tim's mom, Norma, Tim and Ramey were visiting, and unfortunately, Tim's dad was in an advanced illness situation, and he passed. And very shortly thereafter, Norma, his mother, also got an advanced illness diagnosis. And instead of perhaps what many people would do, she decided to decline care. And so they piled into Tim and Ramey's RV with their big standard poodle, Ringo, and they went across the country. And it caught fire, it went viral, and Norma got invited to go to beer halls, and she parachuted, I think, and hot air ballooned, and just had an experience, a quality of life that we don't always think of in advanced illness. And they're going to be our first CTAC caregiving fellows. So they've been out for a while now on that mission, doing blog posts, traveling the country, and talking about what caregiving could look like. We know that caregiving is a significant part of advanced illness care, and we know that demographically, it's not a question of if for Americans, it's when will we be in a caregiving situation. So they're going to bring some light and some fun and some pictures and some stories to that. So those are 2 that we would really like to highlight. They're going to be more on the stories. Maybe they grab your heart a little bit. We're going to have research. We're going to have data. We're going to have policy. We're also going to have those stories that will be fun to repeat when you get back home. Sorry, that wasn't too long.
No, that sounds very interesting. Definitely like that person perspective, and the data and everything's great, but sometimes those are the things you walk away with are those stories. So thank you for sharing those. Do you feel that, you know, you mentioned a lot of different stakeholders that are going to be speaking there and a lot of folks that come to the conference. Is there any one particular group of individuals that you feel might get the most benefit, or the one that maybe we should help really encourage to come and engage in the conference?
I think there's two ways to answer it. I mean, if your work directly applies and you're interested in making change, and this will differ from an event, an industry-specific event where you're going to, you know, see just your peers or get that continuing ed credit. This is really looking for systems and thought leaders. We're going to have significant amount of executives. It's going to be, again, a broader tent, people from all aspects of this. And I think anybody who really thinks they have the interest or the power to make that change or want to have the power should be in attendance. So again, it's everyone from the faith-based community, patient advocates, to the biggest names you can think of: American Hospital Association, American Heart, disease organizations. So it runs a broad spectrum, but what's significant is the conversations can be had from all points. Everybody has a say at this summit, and you'll be able to just get a good view of what everyone's working on. And then the coalition's value is to keep that organized and comprehensive and shared and moving forward. And that kind of goes to why, you know, they're in Colorado. It's something where we know that the work at DC, at Medicare or policy work is really significant, but CTAC has heard loud and clear that the value in the coalition is also in the field. It's also what's going on at the state level. So, you know, Colorado needs to hear what Rhode Island's doing, and New Mexico needs to know what Oregon's doing. And that is really the excitement about coming to the middle of the country and coming to a city like Denver and a state like ours, because we're looked at as a collaborative state, and we're looked at as a place where healthcare has a high priority. And you know, things, you know, we're not sure what the future holds on primary care, for example, but we have worked on advanced illness. We have moved things forward, and you know, that's kind of our reputation. So, you know, good on us for having that reputation around the country, and we're an inviting place, and October is a great time to be in Colorado. So we're really excited. Tell your friends, bring your friends. You know, we'd love to see a great response from Colorado. Like I said, we've been extremely grateful and thankful. The reception we've had, the events we've put on this summer to bring CTAC to town have just been well received, and we just can't thank you enough. But, you know, we'll be a final push in September, and, you know, you'll hear from us a bit more about the summit.
Oh, wonderful. Well, you stole my last question, so great to get that answered. But as to why you're moving to Denver, and definitely think that there's a lot of action here, and certainly excited to have you. And plug for Colorado, it's great in October. So
yeah, I mean, Colorado made me look good, because I told the staff and the leadership that, yeah, you know, coming to Colorado is a great place, it's a great idea. I believe will be well received, and it's just been that, and probably a little bit more than all expected. So I want to say a thanks as the person here on the ground who put my neck out a little bit for the state. You guys have responded terrifically, and you know, there's things that are going to be addressed that are very specific to Colorado and to the West. You know, I introduced the concept of pioneer regions, and that kind of gave everyone a shake. You know, we understand urban and rural, but when you get out west of the Mississippi, many states, if not most of them or all of them, there's another concept of density where there's some people really isolated. And I think some of the panelists and some of the topics and breakouts, et cetera, are going to try and say, how do we deal with this? I mean, it's an issue all across healthcare, from primary care to acute to advanced illness. So we're really excited that that's going to be addressed, and we really think people in this region, the west side of the country, are going to get a lot out of it.
Wonderful. Well, thank you so much for your time. I don't know if we have any questions from the audience or any last words you'd like to share, Tim.
You know, I just, again, one of those things, I'll give you a personal anecdote. I did a lot of work educating small business and business groups around the healthcare reforms we tried to implement in primary care. And back then, one of the issues was, you know, what are we going to do with end-of-life care, death panels was the word, the rationing. And what I found over the 6 years since those conversations started, how many people in the business community especially, but many people, just start shaking their head when I start describing the work I've been doing or what the work CTAC's all about. And what you're finding is a lot of people have started to go through caregiving or advanced illness with family members mostly. And they understand now why some of the reforms were talked about a few years ago and why this issue is massive. You know, for a while, we had a small amount of people using a large amount of resources. We tend to use, as many people know on this call, a lot of our healthcare resources at the end of our lives. With baby boomers and the next 2 generations following, we really have to address this. We cannot, if you don't think we can afford primary care, we can't afford advanced illness care. So what I've seen is I guess an agreement that this is a big issue, and an agreement that, yeah, this is really interesting work and we really need to address it. And I'm really excited over time to see the business community starting to pay a lot more attention to this, because not only do they have costs on providing health insurance and costs on retirement issues, but they also have caregivers sitting at their desks using their resources, you know, their time, their computers, their money. So we have to have this discussion of how do we handle this as a society. And I think Colorado is going to be a robust conversation in October, and I think it's just going to get better from here. And we're really excited about the summit in October. I think I told you the 9th to the 11th, downtown Denver. Website, ctaxsummit.org. And there is a discount for Colorado, interested Colorado participants, so we can get that information to you.
Wonderful. Well, thank you so much, and great discussion, and I'm so glad that you were able to join us and share your insights with that. I know I'm looking forward to it. Just wanted to let you know that the recording of this discussion will be shared via social media on the Civic site in the coming days. Hope to see you all there in October. Just want to put a plug in there for that CTAC conference, the 9th through the 11th. And Civic is also hosting a pre-conference for providers geared at advanced care planning. So that's October 8th, just the day before, also downtown. Feel free to reach out to us if you have any questions, or would you like information on that discount code for those Colorado folks coming to the CTAC conference. You can email us at info.civic.org, or info@civic.org, my apologies. Join us for our next chat on Tuesday, September 11th, when we chat with Northwest Colorado Visiting Nurses Association on behalf of Northwest Colorado Community Health Partnership about how they use the COAPCD data to avoid emergency department visits. That is a mouthful, but it'll be a very good discussion and great work that they're doing here. Thanks again, everyone, for joining us.
Thank you.
Thanks, Tim.